Okay, welcome back for the second part of this afternoon session on fatigue and effort. Our next speaker is Marieke van der Schaaf, and she is a professor at Tilburg University and will talk or will show you work on immune-induced fatigue.
Yes, hello. Thank you very much for your introduction and also for inviting me to tell you a bit more about, so we've learned about fatigue. There are very different ways to look at fatigue. And today I will tell you a bit about fatigue in the context of sickness. Let's see. So, and the reason I got interested in fatigue and also in relationship to sickness is that fatigue and also different kind of cognitive problems, concentration problems, they occur a lot in people with chronic diseases. So, for example, people that had cancer treatments often develop fatigue problems, but also cognitive difficulties, concentration problems. With the COVID pandemic, we see that people develop long COVID, which is also involving severe fatigue problems and cognitive problems. And all these things have a huge impact on daily functioning, occupational life. But currently, there's little known about what is the underlying cause of these problems. Also, fatigue is very multidimensional. So you can look at fatigue as a physical thing, that you don't feel that you don't have the energy or the physical energy to be active. But there's also a cognitive side of fatigue, the mental fatigue. So I'm studying fatigue in the context of sickness. And as you probably all have experienced, if you're sick, then you have various symptoms, which include the increased temperature, increased pains. You might have less appetite, but there's also changes in your behavior. So you feel fatigued. You might be a bit more depressed. You socially withdraw. You don't want to go to parties. But there's also cognitive problems and changes in your motivation. So you'd rather lie in bed than go for a run, for example. So in general, if you're sick, you have a reduced engagement in effortful activities. And within the sickness framework, this is seen as an adaptive response to the sickness, which helps you to redirect your energy resources to fighting the infection rather than to go do stuff that spends energy. So fatigue in sickness is related to a change in your effort allocation, allocating more effort towards internal processes that fight disease and away from external processes. And this is also intrinsically linked to your decisions about whether you want to work or rest in order to get something out of it. And this can be physical as well as cognitive. And how and I will show you today two studies where we look at decision-making, effort-based decision-making, and how this is affected by sickness. And in general, this relates to the effects of the immune system on the brain. So generally, if a bacteria or a virus enters the brain, this is recognized by your body, and this elicits an immune response in the brain. And this involves the release of cytokines and chemokines. And these are, for example, interleukin 1 or interleukin 6 or tumor necrosis factors. And these immune mediators, they coordinate local responses in the body, but they also can message to the brain that things need to be changed. And if you look at how inflammation affects brain function, this is a really nice meta-analysis that has looked at various studies, both immune manipulation studies as well as observational studies, showing the changes in functional fMRI activity in the brain. And as you can see, this mainly involves anterior cingulate regions as well as ventral striatal regions. And these have much overlap with what we know are related to effort-based decision-making. This is also another meta-analysis showing how effort and value are processed in the brain in various tasks where people need to decide whether they want to spend effort for rewards. And they also show that effort and the value are processed in partly dissociable networks. So one of the questions is also like, what is inflammation doing? Is it affecting these more effort-related regions, or is it affecting the more reward-related regions? And these regions have also been shown to be modulated by fatigue, as well as by dopamine and serotonin function. So in rodents, they've studied this, they've assessed how inflammation affects motivation by testing whether an animal is willing to either climb a barrier or push buttons in order to get a bigger reward versus gaining a smaller reward or less preferent rewards without having to do anything. And if you inject one of the cytokines, or if you induce inflammation in the animals, the motivation to work for a higher reward is reduced, as you can see on the right. So this has suggested that inflammation reduces the motivation to work for rewards. And they also showed that if you give the two types of rewards at the same time, there's still a preference for the high reward. So it's not a change in preference. So far, when these studies came out, this was not done in humans yet. But these studies, these animal studies show that inflammation can change motivation, can change decision-making in physical effort tasks. But if you look at the clinical problems that people have, there's also a lot of mental fatigue and cognitive problems. And there's still a discussion about whether this is a problem in motivation, a change in their motivation, or whether there's a direct effect on cognitive function itself. So there's some evidence that inflammation can also have direct effect on cognitive function. So the two studies that I'm going to show you, they aim to answer several questions. One is that, does acute inflammation increase effort sensitivity or reduced reward sensitivity during a physical effort task? And the same question, does it change effort or reward sensitivity in a mental effort task? Also, does it has a direct effect on the physical or mental ability of performing the task? And whether there's a relationship with either the cytokines or fatigue. And the way that we do this is by using an acute immune manipulation model, which is called lipopolysaccharide. And lipopolysaccharide is the cell wall of an E. coli bacteria. And this can be intravenously administered in healthy humans, and it elicits a very standardized response in the cytokines. So here, let's check if I can show you. Here you see the increase. Oh, there's the pointer. Yeah, here you see an increase in the cytokines, which peaks around 1.5 hours after administration. And then it goes down, and after 6 to 8 hours, the inflammation response is normalized again. So basically, the cell wall activates the immune system, then it discovers it's a false alarm, and it goes back to normal. And this also elicits severe sickness symptoms. So here is an overview of how people respond to it. These are symptoms like chills, headaches, not feeling well. And these also peak around 1.5 hours, just at the peak here. There's also increase in body temperature and increase in heart rate that also goes down again at the end of the day. And there's changes in mood. So in this case, there's positive mood going down. So I was lucky that I could join one of these trials that are conducted by the intensive care medicine departments at our hospital. And in this case, I was able to assess an effort-based decision-making task in 29 males that were, 14 of them were given LPS and 15 placebo. And we used a task that was developed by Masoud Hussein, where people had to choose whether to accept or reject offers with varying levels of effort and varying levels of reward. And there were 5 reward levels, from low to high and 5 effort levels from low to high. And these were calibrated to each individual maximum voluntary contraction. And we measured them during 3 time points. So before they got the LPS, at just after the peak. So at this point, people feel really sick, they lie in their beds, but then at 2 hours, they are able to do the task again. And then we do it at the end of the day, after 5 hours. During these time points, you see that fatigue, as measured with the profile of mood states, increases. And then it wasn't different anymore at the end of the session compared to placebo. And what we saw is before, you see the expected effect that if effort levels are higher, people are less likely to accept the offer. And if the stake level is higher, people are more likely to accept the offer. And there wasn't any difference between the LPS and placebo condition. But then after 2 hours, there was a marked decrease in especially the highest effort levels, which suggests that people get more sensitive to the efforts in their decisions. Well, there was no difference in the reward level. And this effect disappeared at the last session. We also did some control measures. So people had to perform all the effort levels prior to each session, and they were still able to perform all the effort levels. So there was not a change in their ability to exert the effort. And also we separated the choices from the execution. So they first did all the choices and only afterwards they had to execute them. So there was no effect of fatigue buildup during the task. So the second question was, can we see a similar pattern if we, so one of the main results is that in the case of physical effort, there's a selective effect on effort sensitivity, while there's no effect on reward sensitivity. And then I got a new opportunity to join a new trial, and this time they were going to test 100 people, of which 85 were able to did the task. And this time we did a mental effort-based decision-making task. We had the same design, so people did it before at 2 hours and at 5 hours. There was a marked increase in the cytokines, very standardized as we would expect. And there was a change in the fatigue that also peaked around 2 hours and then reduced to baseline levels at 5 and 6 hours. The task that we used, it was a task that is developed by Liane Schmidt, where people had to do arithmetic calculations. We had 3 effort levels and 3 reward levels. The easy one was adding or subtracting numbers, and the last 2 were always 1 plus 1. And then for the medium, it's only 1, 1, and for the hard one, it's more than all the 4 numbers were different, and it included also calculations above the 10, which are considered more effortful. And then people could gain points, 5, 6, and 7 points if they were correct. And they just had to accept or reject these offers. If they reject, they would get 4 points anyway. And if they accepted, they could win the points, but if they were incorrect, they would lose a point. So this really helps them to put in effort to be correct. We also trained them before on all the effort levels, and we assessed their performance prior to each session. And here they had to do the execution directly after each choice. So the results, these were the results on the probability correct. And as you can see, they were more correct for the easy ones compared to the medium and the lower ones, but there was also a marked learning effect across sessions. So especially between the first and the second session, they improved on all trial types. Also the reaction times decreased across the session, but especially for the medium effort ones, they were slightly slower. Maybe because there was a more considerable choice. And these are the results concerning the acceptance rates. So whether they accepted the offer or not. The easy ones were almost all the time accepted, while the difficult ones were accepted less often. And we only saw an effect of the LPS for the medium difficult ones. So there was a decrease in acceptance rates during session 2, which recovered during session 3. And this is an effort effect that was seen across all the 3 reward levels. So here you also see that if the reward is high, they would accept more offers, but this effect of decreasing was seen across all 3 effort levels. So also here you see that there's an effect of efforts on choice, or the inflammation affected the effort sensitivity, but not the reward sensitivity. But here we only saw it in the medium effort trials. So a last question was also, can we link these effects to either the cytokine response in the blood or to the fatigue that people report? And we first started with assessing the cytokine levels. We computed a compound measure that was a combination of 3 different cytokines and tested whether the change in the cytokines correlated with the change in the acceptance rates on the medium effort trials, but didn't find any relationship. And then we looked at fatigue, and here we did find a relationship that the more fatigue increased between session 1 and 2, the more also the acceptance rates decreased on the medium effort trials. So taken together, acute inflammation selectively affects effort, but not reward sensitivity. And this is seen both in the physical and mental domain. And the physical and mental accuracy remained intact or even improved in the cognitive, if in the mental effort tasks. So this kind of suggests that inflammation may have also selective effects on certain neural circuits that are more important for the weighting the effort in decisions, rather than that it changes your sensitivity to rewards. One of the surprising findings was also that inflammation only affected the choice on the medium effort trials. We were hoping for a linear effect also, that you saw higher effects for a higher effort. But in this task, we didn't calibrate the difficulty levels for each subject. So for some, the difficult trials were too difficult. So we think that this effect on medium effort trials might relate to the expected benefit of the invested effort, which might have been the highest for the medium effort trials, and that you don't see it for trials that are either too easy. So in putting more efforts will not further improve your reward output, and that too difficult trials may people would not even try to improve on that. And also the change in acceptance rates was not related to the cytokines, but it was related to the self-reported state fatigue, also suggesting that this might be some effect that is related. It's still a question whether this is really related to the cytokine response in the body directly. So the reason that I got into this is also that I want to understand more the chronic fatigue. But what you see here, of course, is a normal reversible effect. Oh, sorry. Then I'll skip to the. So yeah, let's see how can I see this really shortly. Yeah, so what I in the end like to do is also compare these kind of acute inflammation effects to how does that transition into long-term problems that people can experience after disease. So we've shown that during acute effects, there is a I'm just thinking about what to say in a very short time. So yeah, maybe one of the main messages is that there's quite some evidence now that inflammation has effects on dopamine and serotonin systems in the brain. These have also been linked to various symptom dimensions that patients have, and that it's one of the major challenges now is to translate, like, how does this acute effects can we learn from these acute effects on how inflammation affects the brain, and can this tell us something about how this transitions into long-term problems? And then I'll skip this one, and I'd like to thank all the people that were helping me during this trial.
What's first? I'm first. Sorry. Great talk. There are occasional reports of euphoria or mood elation during sickness behavior in healthy participants, but also in depression. Some patients report that during, for example, a flu, there are a decrease of their symptoms of depression, that's quite rare, but that's described. And so I was just wondering to what extent you had any clue about that, to what extent maybe in some subject it could have a reverse effect, or to what extent some cytokine might have a, yeah, just wondering about that.
So you're saying that some people that have major depression,
well, it appears both. I mean, there are descriptions of people, I mean, without any depression or without any psychiatric disorder that during flu, they don't do anything, but they feel like euphoria, or they feel in a better mood. And that's the case as well in the clinical world. I mean, with patients with depression that are paradoxically improved during a few days during sickness, during flu, for example. So during the 2 or 3 days in which there is the flu, there is less depression. There is a paradoxical improvement of their depression during this. I mean, that's not the usual, that's not that frequent, but that appears, and that has been repeatedly reported. And so I was just wondering to what extent there is any.
I think that's really interesting. So far I know that inflammation has been linked to more severe depression. Yes, so sorry, I can't answer that.
Yeah, that was a very interesting talk. And I was really surprised at the last bit of information that you gave, which was that inflammation did not seem to affect choices, but fatigue did. Yeah. But we do know that inflammation does, in the acute phase, predict levels of fatigue. So did you look at a three-way interaction to look at fatigue, inflammation, and choice?
Yeah, so fatigue was not related to the cytokines.
Ah, okay.
But
was that expected?
I was hoping that we would find this relationship. Yeah. And then, or at least maybe not with fatigue, because it's a subjective report, we would find a relationship between the cytokines and the choice behavior. But we ended up finding the relationship between fatigue and the choice behavior.
How would you explain it? Because my understanding was only in the chronic phase, inflammation and fatigue was delinked, whereas in the acute phase, there was very close tracking of inflammatory response.
I guess
fatigue.
One explanation is that fatigue is a combination of all kinds of things that happen. So there is the time of the day, there is the maybe boredom having done, and that may be the link between effort-based decision-making, and fatigue is involving all these kind of effects on fatigue and not only the sickness.
Okay, now I was just surprised because the effect of such acute induction is quite large. Yeah. So you would think that it'll actually overshadow all of the other factors that could impact fatigue.
Yeah, but there's also still a lot of discussion about this relationship between cytokines and fatigue. And you see that there's a lot of individual variability in the fatigue reports. Well, the cytokine response is very robust. So it's not a one-to-one relationship.
Yeah. Do you think there might be a relationship? I see that you tested only male participants, and we do know that in a lot of disease cohorts, there is a greater incidence of reported fatigue in females than in males. And could that have reporting bias?
So the second trial was in males and females.
Oh, okay.
So that's halfway, and it's been shown repeatedly that there's a difference in the immune response between males and females. We did an analysis where we controlled for gender, but didn't find any effects from it. So.
Okay, thanks.
Yeah, thank you for the very interesting talk from my side as well. I was wondering, so this is not my topic, so excuse if it's not a great question, but I was wondering if there's a way to differentiate between the motivational aspect of exerting effort and actually the costliness of doing the behavior. Because I could imagine that a sick person or animal, it does not only affect the motivation or the aversion to exert effort, but it might actually also make a lot of things more costly. So for example, like going for a jog might just be more difficult for me when I'm sick, when I'm healthy. So what is your perspective on that?
Yeah, so one of the views here is that it's the effect of inflammation is an effect on your motivational prioritization. So it's not necessarily that the going for a walk is harder, or it's just better to spend your energy resources somewhere else. And then by affecting certain brain circuits, it changes your motivation. So I'm not sure if it's really affecting the energy that you need to use to go for a run, whether it's different or whether it's just your choice to spend your energy differently.
I see. Thank you.
You mentioned that acute inflammation decreased dopamine and serotonin. Is that also dopamine and serotonin recover after when they recovered from the acute inflammation? Or
so yeah, generally I think it's a transient change. So during sickness, there's changes in your dopamine and serotonin systems, which recovers when you get better. But the question is, of course, what happens if people have long-term problems or long-term sickness? Yeah. Might there be some dysregulations in these systems that also stay longer?
So you're finding that didn't find these to the immune system, but could it be like intervene, like sort of it has to go through this dopamine or serotonin system to like influence their performance?
I'm sorry, can you repeat that?
So there's a lot of studies showing that dopamine level and the effect on the effort and reward task. So would that the immune system has to act through the dopamine or serotonin system to affect the task performance?
That will be my hypothesis, yes. And there's, I skipped the complex figure here, but this one is a figure that kind of summarizes the the evidence that is already there, where they show that, let's see, oh, where's the pointer? So here there's the inflammatory cytokines, and they have, on the one hand, they affect the tryptophan pathway, which is involved in the serotonin and also glutamate levels in the brain. And on the other hand, it has an effect on this BH4 enzyme, which is important for the dopamine levels in the brain. And also, some people have differently dissociated changes in this pathway to, for example, depression symptoms, while the dopamine pathway might more be related to the psychomotor slowing, the fatigue, and the motivational problems that people show. But these are still theories and hypotheses, and I think there's still more research needed to really dissect these kind of pathways and the links to various symptoms.